Good evening, ladies and gentlemen. Thank you so much for joining us this evening. Our webinar will begin in just a few minutes. Just as a few housekeeping formalities, just to give you some information. On your screen, there is going to be a poll that's going to show up in just a moment. If you would be so kind and to fill that poll out for us, we would greatly appreciate it. In addition to that, at the end, we're going to do a Q&A session. You'll be able to put your questions into the box at the bottom of your screen that says Q&A, and Dr. McClary will be able to answer those questions for you. Again, we do thank you for joining us this evening. We are going to begin in just a moment. If you see a poll on the screen, if you can take the time to fill it out, we would greatly appreciate it. So without further ado, I'm going to introduce one of the Medtronic individuals who work with Dr. McClary, and she's going to introduce Dr. McClary, who's going to be leading our webinar this evening. Janelle?
Hi, everyone. Good evening. Thank you for joining us on our webinar tonight. My name is Janelle. Like Kenya mentioned, I am one of the Medtronic representatives here in Phoenix. So if you were to move forward with one of the trials and an Interstim procedure, you would likely see myself or my coworker Tatum, who is also on the call. And I look forward to meeting you all. So without further ado, I'd like to introduce Dr. McClary. So Dr. Fox McClary grew up in Western Washington State, attending Central Washington for college and University of Washington School of Medicine. During college, she took a break and enlisted in the U.S. Navy as a hospital corpsman, returning home after a brief period of active duty to the reserves, later receiving a commission as a medical officer until 2007. When she resigned as a lieutenant commander in the medical corps. Dr. Deborah Fox McClary is a dual board certified surgeon in both general surgery and colon and rectal surgery. She completed residency training in general surgery at the Mayo Clinic in Rochester in 1999 and a fellowship training in colon and rectal surgery at Mayo Clinic in 2000. Dr. McClary focuses on surgical treatment of diseases of the colon, rectum, and anus, such as diverticulosis, colorectal cancer, perianal fistula disease, hemorrhoids, and IBS, as well as a great interest in women's health and pelvic health disorders. Dr. McClary.
Thank you very much, Janelle, for the introduction, and welcome everybody to the presentation tonight. Super excited to talk about this and to have all of you here. So let's see here. So up to, I would say actually about, I think we'll see some other numbers here in a little bit, but as many as about 1 out of 10 people over the age of 50 struggle with fecal incontinence. It's a terrible condition for people to experience. They ask questions like, will I ever regain control? How can I go out? These people often avoid social events because of the embarrassment of the situation. More than half of those patients never discuss this with their doctors out of fear of what type examination might be done, or out of fear of ridicule. So again, very glad to have everyone who's here tonight here. So you're not alone. This slide here says 1 in 12 patients. The problem can affect men and women of all ages, though I see it increase as we get older. Fecal incontinence obviously causes embarrassment, social withdrawal, and a lower quality of life. So it doesn't have to be this way. We don't have to spend our time planning it around the bathroom. I see people going to the malls and looking up the bathroom sites on the internet before they go, or simply shopping off of Amazon. The stool, of course, is embarrassing. Many people will carry extra undergarments with them, and all of these things are just not normal, and they're not a necessary part of life. So our bowels start with control from our brain. Our brain is tied in directly to our rectum. The brain will receive a signal from the rectum when it's full. The rectum sends a signal to the brain and says, now's the time for me to go to the bathroom. And in a functioning system, your brain can send a signal back and say, yes, now's time to go, or it can make it so that you have time to do other things before you use the bathroom. So I talk to a lot of my patients in the office about a common scenario that many of us see ourselves in will be, say, at the grocery store in line for checkout, and we feel the urge to have a bowel movement. And if the system's functioning, you should be able to suppress that and finish what you're doing and go to a bathroom at the later time. This breakdown of communication between the brain and the bowel results in urgency, accidents, a need to run for the bathroom, and all of the scenarios that we've discussed in the previous slides. So for many years, I had very few options available to me, but now we have what we call advanced therapies that help to restore the communication between the brain and the rectum. And so Medtronics has been a great partner in bringing to market some solutions that work for many people and provide a restoration of normal quality of life. We do recommend trying some conservative treatments before doing the more advanced therapies. We specifically call that medical constipation, and we'll work with things like dry fiber and Imodium to try to help people have thicker stools. Thicker stools are generally easier to hold. We do recommend physical therapy called biofeedback, and this is by specialized physical therapists trained in helping with pelvic floor issues. And again, there are medications we use that can try to help thicken the stools and slow down the bowels. I would say that though these can help a little bit, in most people, they aren't the solution. And that's when we turn to these advanced therapies. We have these options now, specifically what we're going to discuss here in a minute, the Interstim device. And this is a minimally invasive treatment. It's an outpatient surgery, and again, very successful, improving people's quality of life. So when I evaluate somebody in the office for problems with control, one of my first concerns is that they have an intact anal sphincter. The anal sphincter has to be shaped like a circle. In many cases for women, the act of childbirth can result in an injury to a sphincter. And so sometimes in that setting, we'll recommend repairing the sphincter muscle. We also see injuries to the sphincter after people have anal surgery, such as hemorrhoid surgery. And so these are surgical options here listed on the slide, including the post-anal repair, sphincteroplasty, and this last one I call the elephant in the room. Colostomy will fix all fecal control issues, but I have yet to meet anybody who wants a colostomy in place. So whenever we can, we like to avoid this option. So the Interstim device is shown here in this picture, and it includes a small computer that goes under the skin, in the fat under our skin, and there's an electrode that we feed in behind the rectum, and we piggyback this on top of the normal nerves that run the function of the rectum and also run the communication back and forth from the brain. So this device then provides a better electrical system to nerves that are no longer working as well as they once worked. And it restores the communication pathways between the brain and the bowel. We see multiple studies showing that this reduces or greatly reduces or completely stops bowel accidents and improves patients' quality of life. It's very safe, having been used for many, many years. And we have options through Medtronics of a device that lasts in excess of 10 years and another that's a rechargeable device. So 375,000 seems small to me. I would expect a much higher number. I see patients going through these procedures every day for both urinary incontinence and for fecal incontinence. In all of these cases, we like to start with a nerve test at the office. The nerve test is very much like having an IV line put in at the hospital. So we take care of all of that in the office setting in about 15 minutes. We then send you home for the nerve test for 5 days to try this. And during this time, the technicians from Medtronics work with you on adjusting the settings on the temporary system. If the temporary system seems to be improving your control by more than 50%, then we like to proceed to putting a full system in surgically. The full system's completely under your skin, and unless someone knew you had this on, they wouldn't even be aware it was there. The latest systems from Medtronics are MRI compatible. This is really important because for years we did not have MRI compatible devices like this. And so now with the latest generations of the Medtronics device, patients are still able to go and get MRI scans. And so the technicians and or my office can work with the patients when they go to have this done so that they remain safe during the MRI scan. So we think if you suffer from fecal incontinence, and as often is the case, medications don't provide a long-term solution for you, then you may be a good candidate for this device. Patients do very well with this. They are able to travel with this, go on airplanes, shop at the mall, and do all of the things that they normally like to do. In short, a much better quality of life. Let's see here. So proven results, yeah, above 85 to 89% of people who have an Interstim device in see long-term success with control of their incontinence. They see a significant quality of life improvement. And we know because these devices have been used for years now that they are safe and effective. This last slide then has my name and office information available. I really encourage all of you to write down this internet web address, as Medtronics has done a fabulous job of putting together videos, testimonials from other patients who have had these devices put in, what we call Interstim ambassadors. And it's just a wealth of information at this site. So if you retain very little else from this, make sure you write down this internet address. And thank you very much for coming to the presentation tonight.
Thank you so much, Dr. McClary. I am going to turn it over to Janelle, who is going to lead a Q&A, answering some questions that have been fed into us. And Dr. McClary, if you'd be so kind as to answer those questions for us, we'd greatly appreciate it. Janelle?
Yes, thank you, Kenya. So the first question we have is, does insurance cover this?
So that's a really great question. And as we all know, insurance is a little bit of a lottery these days. If we follow the proper steps, then I have not seen any trouble with getting insurance to cover these items. What we do first is after an office exam, it is necessary to try a period of what we call medical constipation. And again, I don't see that work long-term for most people. And if it doesn't work, then we proceed to the in-office test. And finally, we can proceed to the surgery done in the operating room. Medicare has been fabulous at covering this. And I've also seen coverage with both commercial insurances and access. So my answer to that would be very good coverage across the spectrum.
Thank you, Dr. McCleary. Next question is, I have bladder and bowel issues. Can this help with both?
That's another very good question. So we know that the nerves that run the bladder also run the colon and the rectum. So they're very intertwined. And it is common then that implantation of a device like this could fix both bladder and bowel issues. Having said that, the bladder has some unique innervation to it, and there are other things that can cause bladder control issues. So it's advisable, if you're having any type of bladder problems, that we also have you evaluated by a urologist. There are several in the Valley who are amazing and very good at working with these devices.
Thank you. And next question is, if I've had prolapse, can I get it?
So absolutely, if you've had prolapse, you can get this. I do rectal prolapse repairs regularly, and we do see probably 80% of women and men recovering control of their bowels after we repair the prolapse, but there is a small percentage who don't improve, and in that group, we recommend placing an Interstim device, going through the steps that we've talked about, the in-office nerve tests, and then the actual implantation of the device. And this can provide excellent improvement in control.
Before you ask your
And
next question, Janelle, there is a second poll that has just come up. The participants that are with us this evening, if you could fill that second poll out for us, would greatly appreciate it. Thank you.
And last question that I see, will I be limited in activity?
So another really good question. The purpose of this device is to get you busy and return to full activities of life. And so the long-term goal is that you're doing everything that you want to do. Now, in the short term, immediately after the surgery, so say that I put a device in a patient, I don't want them to go out and go on a wild ride at the fair the next day. They need to heal for a week or two. But after a week or two, we know that it's very safe to engage in all of life's activities. Specifically, in cases like this, there's a few items that is recommended against, I've seen in the literature for the Interstim device. One is to avoid use of a jackhammer, for example, or we would want you to try as much as possible to avoid falling onto your back where the device is placed. Finally, in the 1970s and 80s, we used a thing called a diathermy device, and it's not advised for you to have diathermy when this is in place. But I don't know of anybody who has those devices any further today. And so if you were to go and have a surgery after the Interstim is placed, we want you to let us know, because we like to put it into a safe mode just for the period of the operation. And other than that, I think we encourage people, I would say those are relatively minor limitations. And other than that, we encourage people to live a full and active life.
Well said. Dr. McCleary, thank you so much for your time this evening. I greatly enjoyed your presentation, and I hope that those who attended today were able to gain something from it. Again, if you were able to take down information and like to schedule an appointment, please do so. You'll also be receiving this video again for your listening pleasure via email or the way in which you've registered. So again, Dr. McCleary, thank you for your time, and we do thank all the participants for joining us this evening. This concludes our webinar. Thank you.
Thank you, Kendra. Thank you, everybody, for coming.